all. I am Rokini, Assistant Professor, Department of Biomedical Engineering. I am going to take a class on this topic, patient monitoring system. So we are already aware of this. When we visit a hospital, we see a lot of monitoring systems are available. Why it is needed? It is needed because of to decrease the mortality and morbidity ratio. What is the meaning of that? That is to decrease the death ratio and to decrease the ratio which going serious ill condition. So how we can avoid these two things or reduce these two things? Because of continuous patient monitoring cases. So in this continuous patient monitoring cases, there are different types are available. Normal patient monitoring system, then bedside patient monitoring system, then ICU based patient monitoring system. So whatever the methods, there are primary cases, the parameters will be primarily monitored. One is ECG, we well know that so many films we may see that, then heart rate, then pulse rate, then oxygen level SpO2, then blood pressure, temperature. These are all the primary things will be calculated and monitored in every case. And there are some specific cases. If somebody having a neurological disorders, if they are in hospitals, we need to monitor their EEG levels also. And somebody is having a disease related with their respiratory system, we have to monitor the respiratory parameters. Respiratory parameters means by using this any capnography monitors, when we monitor the exhaling CO2 level, so that will be the one thing. Then another maybe defibrillators may be used and cardiac pacemakers. So these defibrillator and cardiac pacemakers will be used in the case of the patients who are related with heart related issues. So these are all the primary cases. We know what is ECG, electrocardiogram. So in that ECG they use 5 or 6 electrodes they will placed. So from that electrodes they will continuously getting a signal. It will be connected with the processor and analog digital values. Then ECG waveform will be displayed. We know that. So from the continuous waveform of that ECG waveform, from the ECG waveform time interval or peak to peak time interval, they will calculate the heart rate. Then based on your oxygen level, they will place a pulse oximetry in the patient monitoring system. They will calculate the SpO2 value and blood pressure. Blood pressure monitoring system, so based on which case they are going to monitor. It is in a surgery cases, they will monitor with the invasive method. And if it is a non-surgery cases of monitoring system, they will use non-invasive method. So generally when we visit a hospital, they are using a non-invasive blood pressure measurement. So that is also nowadays come out as an automatic system. So we no need to increase or decrease. So they will fix that along with the patient monitoring system. They will include that non-invasive blood pressure monitoring system. So it will continuously monitor and that value also displayed in that monitoring system. If it is a surgery cases, they are doing some surgery related, for the cases they may use invasive method of blood pressure monitoring. So they will directly connect with the main artery which came from our heart. So they will measure the accurate blood pressure and temperature with the help of infrared based temperature system. So like this they will monitor and these values will be continuously displayed in this monitoring system. So and also you know that EEG, electroencephalogram and respiratory parameters, they will monitor the carbon exhaling CO2 value with the help of capnography device, and from that they also measure the inspiratory reserve volume, force, vital capacity, slow vital capacity, expiratory reserve. From these values will be measured, and along with the help of calculation they will find out the total lung function. So mainly CO2 will be displayed as a non-faded thing, and the remaining things will be calculated based on particular time intervals. Okay, so these are the main cases in the patient monitoring system. So what are the things happen means any type of element for electrodes, they will place the transducer first. From that transducer to it will be given to an amplifier. We all very familiar that your biosignals are very less in signal strength. When we want to take that signal and we want to process to the next level, surely we need an amplifier. So for that we will use that instrumentational amplifiers. That amplifiers should having the high CMRR, high common mode rejection ratio. Okay. Then from that amplifier to it will be given to the analog to digital converter, because most of our processor will be used in a digital based system. So it will be given to analog to digital converter. Then processor will be used to analyze the signal. Again it will be displayed in the monitors. So this is the development of that patient monitoring system is how much level of normal TV based monitoring system are developed. Those things will be utilized in a medical system also with the higher range of accuracy. So in that higher range of accuracy means initially they may use a normal of 8 parameters may be measured and few things only displayed. Then they nowadays they started to display a almost 10 or 15 parameters in a single monitoring itself. How it can be successful? Because of the memory capacity and the monitoring along with the processor what they are using. They are having the capacity to segregate the different signals with the help of either maybe use of the help of multiplexers and demultiplexers, and increasing the level of memory, we can store a large number of data from kilobytes to some megabytes range of data will be stored. If they want to store the patient data for a longer run, they may use some gigabyte range of memory also. It's based on depends on their requirement. Okay. So because of this continuous monitoring, there are so many serious conditions will be reduced, and specifically for people who are going for surgery cases, they are unable to monitor manually because the doctors will do the surgery. For example, heart related surgeries, so they will do continuous surgery. So for measuring these vital parameters, if any abnormality conditions may be happen means it will be indicated with the alarm. It is convenient for them to notify that. So for that case, your patient monitoring system will be very much useful. Thank you, students. Okay, with the continuation of the patient monitoring system, we are going to see about ambulatory monitoring. First, we have to understand why it is needed. In a patient monitoring system, we already said about the types, which are bedside patient monitoring system, central patient monitoring system, bedside and central patient monitoring system combined. Here, why ambulatory monitoring is different from that means it is the daily routine life. What are the activities that people are involved in? In that cases, we need to do some monitoring. So for that, this ambulatory monitoring is important. So that is measurements for a longer period. We already said that the primary measurements are ECG also one of the primary measurements. In that ECG, when we taken for a certain period, it may not be correct. That's what they suggest that we have to take that ECG for a 24 to 72 hours of time continuously. Then we can come to one medical conclusion from that ECG data. So this ambulatory monitoring system is not only given specifically for monitoring who are already settled as a patient, and sometimes it may be used to identify the problems in which situation these conditions may be occur: dizziness, syncope, then palpitations. So we are all known that when these conditions we are unable to identify when it's going to be happen. So when we go for a continuous level of monitoring system, we can identify these conditions in a accurate stage, what type of activity they are involving, which duration these type of symptoms will occur to those patients. Then and also it will be used to identify the accurate levels of and the response of drug therapy. People are continuously taking some drugs for the particular treatment purpose. We can check the response of those drug for the particular patient, how it will be, how much efficiency it will be working. That one we can identify with this continuous monitoring. And also stress testing, which environment it happened. Then the patients who are already suffered with cardiac related issue, they already placed with the artificial pacemakers and all. To monitor those artificial pacemakers, we need a ambulatory monitoring, not only the bedside monitoring. Even though they are the advantage of that pacemaker is that they can involve in their routine activity. Even we allow them to involve in their routine activity, but still we need to be monitor them. For that purpose, this ambulatory monitoring system will be used. And myocardial infarction. So myocardial infarction, so which is related with your heart block. In your heart muscle, what is the problem occur, that will be identified as a myocardial infarction. So all these things will be continuously analyzed with the help of Holter cardiography device. It's a small box type device with a dimension of 70 to 95 and 20 mm cross size of box with the weight of 190 grams. And these Holter monitors can be placed along with the human wherever the activity they are involved. They will place 2 to 3 chest based electrode system to get the data. And then generally they will monitor 24 to 78 hours, 72 hours, and the data will be stored in that. When they visit the hospital, they can analyze the ECG data, then they will give the interpretation about that ECG, what condition they are having, how it will be. Then next case, nowadays after the new development, they can continuously store the data up to 2 weeks. After 2 weeks, they can go and consult with the doctor, and they can identify and explain about the condition. And the next will be the after the development of advanced levels, along with that monitoring device, they are also can incorporate the interpretation device. From that time to time interval, with the help of wireless system, the data is transferred from the particular patient to their hospital environments immediately. So they can continuously monitor their patient even though they are involved in their routine life. So these are all the advantages of, as we said in the starting itself, to decrease the morbidity and mortality ratio, and also to increase the human span life with a quality manner. This monitoring system will be very much effective. Thank you.